We saw the proximal end of the femur in the last section. Now let's look at the distal end. The two smoothly curved surfaces are the lateral condyle and the medial condyle. The deep notch which separates them is the intercondylar notch. Above the two condyles are the epicondyles, lateral and medial. The sharp corner on the medial epicondyle is the adductor tubercle. This prominent ridge is the medial supracondylar line. This one is the lateral supracondylar line. Now we'll add the tibia and the fibula to the picture. The tibia and the fibula are fixed to each other firmly by two joints, the proximal and distal tibiofibular joints. There's almost no movement at either of these joints. Let's take a look at the proximal end of the tibia. This is the medial condyle. This is the lateral condyle. On top of the two condyles are two quite separate articular surfaces. They're much flatter than those on the femur. The rugged expanse between the articular surfaces is the interarticular area. This prominent lump on the front, the tibial tubercle, is the final insertion of the quadriceps tendon. The small facet under here is for the fibula, which we'll add. This is the head of the fibula, this is the neck. The head of the fibula is the point of attachment of a major ligament of the knee joint, as we'll see. The space on each side of the knee between the femoral condyle and the tibial condyle is occupied by a crescent-shaped piece of cartilage, a meniscus, which we'll see shortly. The space in the middle, the intercondylar notch, is occupied by the two cruciate ligaments. The intercondylar notch and its contents divide the knee joint into two almost separate halves. There's one more bone to add to the picture, the patella, or kneecap. The patella, as we'll see, is embedded within the quadriceps tendon, which comes from up here and inserts on the tibia down here on the tibial tubercle. On the back of the patella, the articular surface is divided into facets. These articulate either with the femoral condyles when the knee is flexed, or with this central articular area when it's extended. Now that we've seen the bones of the knee joint, let's see how the joint looks in the living body. In building up our picture of this quite complicated joint, there are several structures that we need to understand. First, the two joint cartilages, or menisci. Then the ligaments, the two cruciate ligaments and the two collateral ligaments. Then the patella and the quadriceps tendon on the front. And lastly, the capsule, which encloses the joint. Here are the two articular surfaces of the tibia. The two menisci sit on top of them. Here are the menisci. They're made of flexible fibrocartilage. They're shaped a little differently. The lateral one is almost a circle. The medial one is more C-shaped. In cross-section, each meniscus is thick at the outer edge and thin at the inner edge. The two ends of each meniscus are attached to the interarticular area of the tibia. The medial ones far apart, the lateral ones close together. In addition, each meniscus is attached all the way around its edge, both above and below, to the joint capsule. Here's part of the joint capsule. We'll see more of it later. The lateral meniscus is much more mobile than the medial one, partly because its two ends are attached close together, partly because of a big difference in the mobility of the joint capsule around the edge. By filling in the spaces between the femoral and tibial condyles, the menisci produce an even distribution of synovial fluid to nourish and lubricate the articular cartilage of the femur and tibia. Now let's look at the two pairs of ligaments which hold the bones together at the knee joint. The two cruciate ligaments on the inside and the two collateral ligaments on the outside. We'll look at the cruciate ligaments first. They're the important structures which prevent forward and backward movement of the femur on the tibia. Their name comes from the fact that they form a cross, like this. Here's the anterior cruciate ligament, seen from in front. Here's the posterior cruciate ligament, seen from behind. To get a better look at them, we'll remove the lateral condyle of the femur. Now we can see the whole of the anterior cruciate ligament. The anterior cruciate ligament goes from here on the tibia to here on the femur, on the inner aspect of the lateral condyle. The anterior cruciate ligament prevents the femur from moving backward in relation to the tibia. Now we'll look at the posterior cruciate ligament. We'll remove the anterior cruciate ligament to see it better. The posterior cruciate ligament goes from here on the femur to here on the back of the tibia. The posterior cruciate ligament stops the femur from moving forward on the tibia. By preventing backward and forward movement, the cruciate ligaments ensure that the condyles of the femur stay in one place as they roll on the condyles of the tibia. Without them, the femur would roll off the back of the tibia in flexion and would roll off the front of it in extension. Now let's look at the two collateral ligaments, the fibular collateral ligament on the lateral side and the tibial collateral ligament on the medial side. The tibial collateral ligament goes from the medial epicondyle of the femur to the anteromedial aspect of the proximal tibia. The tibial collateral ligament blends with the capsule of the knee joint behind and also in front. On its inner aspect, it's firmly attached to the edge of the medial meniscus, which is here. Now let's look at the rather different fibular collateral ligament. It goes from the lateral epicondyle of the tibia to the head of the fibula. The fibular collateral ligament stands out from the side of the knee joint. Unlike its tibial counterpart, it doesn't blend with the joint capsule. It's not attached to the meniscus. When the knee joint is extended, both the collateral ligaments are tight. When it's flexed, they become less tight. The function of the collateral ligaments is to keep the femoral and tibial condyles together, and thus to prevent the knee joint from bending from side to side, like this or like this. In addition to the obvious knee movements, flexion and extension, it's also possible for the tibia to rotate a little on the femur, like this. This rotation can happen only when the knee is flexed. When it's extended, the tightness of the collateral ligaments makes rotation impossible. The next structure we need to add in building up our picture of the knee joint is the quadriceps tendon, and along with it, the patella. Here's the distal end of the quadriceps muscle, which we'll see in more detail later in this section. Here's the quadriceps tendon. The patella, which is here, is enfolded within the tendon. The part of the tendon below the patella is known as the patellar ligament. On the medial side and on the lateral side, the tendon is continuous with the capsule of the knee joint. Between the quadriceps tendon and the femur is an extension of the knee joint cavity, the quadriceps bursa. It's lined with synovial membrane. This lubricated pocket enables the quadriceps tendon to slide easily on the femur. Now we'll complete our picture of the knee joint by adding the fibrous capsule which encloses it. Here's the knee joint with the joint capsule intact. On the medial side, the thin capsule is continuous with the tibial collateral ligament. But on the lateral side, the capsule is separated from the fibular collateral ligament. On the back of the joint, the capsule is thick and strong. The thickened posterior capsule prevents hyperextension of the knee joint. Here we've divided the fibrous capsule to see its inner surface. It's lined on the inside with synovial membrane all the way around the joint, except at the back. At the back, as we'll see if we remove the capsule, the thin synovial membrane, here it is, passes forward around the cruciate ligaments, covering them on the front. Besides being the largest joint in the body, the knee joint is also much the most complicated. Before we move on to look at the muscles which produce knee movement, let's review what we've seen of the bones and of the knee joint. On the femur, here's the lateral condyle and epicondyle, the medial condyle and epicondyle, the adductor tubercle, and the intercondylar notch. On the tibia, here's the lateral condyle, the medial condyle, the tibial tubercle, and the facet for the fibula. Here's the head of the fibula, the neck of the fibula, the proximal tibiofibular joint, and the patella. Here's the medial meniscus, the lateral meniscus, the anterior cruciate, and posterior cruciate ligaments, the fibular collateral ligament, the tibial collateral ligament, the quadriceps tendon, the patellar ligament, and the joint capsule. Now we'll move on to look at the muscles which produce movement at the knee joint. We've met most of them already. The one muscle that extends the knee is the massive quadriceps. We saw it briefly in the last section. We'll take a better look at it now. The main flexors of the knee are the so-called hamstring muscles, semimembranosus, semitendinosus, and biceps femoris. Besides flexing the knee, the hamstring muscles also extend the hip. We took a good look at them in the last section. Here, we'll just revisit their insertions. In addition, we'll look at three muscles at the back of the knee that we haven't yet seen: popliteus, gastrocnemius, and plantaris. We'll start with quadriceps. Its name comes from the fact that it has 4 heads. Oddly, these are named as though they were separate muscles. 3 of the heads arise from the femur. They're called vastus intermedius, vastus medialis, and vastus lateralis. The 4th head, rectus femoris, arises from the hip bone. All 4 heads converge on the quadriceps tendon, which we've seen. We'll start with the deepest of the heads, vastus intermedius. Here it is. It forms a bulge on the front of the femur. Vastus intermedius arises from this broad area around the lateral aspect and front of the femur. Wrapped around the outside of vastus intermedius are vastus medialis and vastus lateralis. These two cover vastus intermedius almost completely. Their fibers run obliquely all the way round to the back. Here's lateralis, here's medialis, almost meeting it. Vastus lateralis arises from the lateral edge of the linea aspera and from the side and front of the greater trochanter. Vastus medialis arises from the medial edge of the linea aspera and from just below the lesser trochanter. The thin strip of bone between these two lines of origin provides the insertion of all the adductor muscles and also the origin of the short head of biceps. Now let's add rectus femoris to the picture. Here it is. Rectus femoris arises from the ilium just above the hip joint. Its tendon of origin has 2 parts, a posterior or reflected part and an anterior or straight part. The anterior part arises from this prominence, the anterior inferior iliac spine. The posterior part arises from just above the acetabulum. All four heads of quadriceps converge on the quadriceps tendon. The lowest fibers of vastus lateralis and medialis insert onto the sides of the patella. The principal action of the quadriceps muscle is to extend the knee. When the foot is off the ground, that action simply straightens the leg and holds it straight. When the foot is on the ground, the action of quadriceps has several important effects. In normal walking, quadriceps straightens the leg as the foot reaches the ground, then keeps the leg straight while the hamstring muscles extend the hip. Quadriceps is also one of the two big anti-gravity muscles of the lower extremity. Its partner, which we've seen already, is gluteus maximus. Acting together, quadriceps at the knee and gluteus maximus at the hip lift the body upward when we climb uphill, when we rise from a sitting position, and when we jump. The same muscle actions propel us forward when we're pushing a heavy load. In addition to these actions, when quadriceps and its partner, gluteus maximus, act in balance with the force of gravity, they control our rate of descent as we sit down. And also when we walk downhill. We need to digress for a moment to look at a structure called the adductor canal, which lies between vastus medialis and the adjoining adductor longus muscle. The adductor canal is important because the femoral vessels run through it in their course from the front of the thigh to the back. Here's vastus medialis. Here are the adductor muscles, magnus behind, longus in front, and brevis up here. The adductor canal is formed by the groove between adductor longus and vastus medialis, and by this sheet of fascia, called the roof of the adductor canal, which bridges over between the muscles. The adductor canal is covered over by the sartorius muscle. We'll see the adductor canal again when we look at the blood vessels. Now let's move on and look at the muscles which produce flexion at the knee joint. We'll revisit the main flexors, the three hamstring muscles, and two minor flexors, sartorius and gracilis. Here are the hamstring muscles again. On the medial side, here are semimembranosus and semitendinosus. As we've seen, they both arise from the ischial tuberosity and insert on the medial side of the knee. Semimembranosus here, semitendinosus here. On the lateral side, here's biceps femoris. It arises both from the ischial tuberosity and from the femur, and inserts down here on the head of the fibula. We've already seen that these three muscles, which usually act together, can produce either extension of the hip or flexion of the knee. Whether they do one, the other, or both is determined by what other muscles are acting in opposition to them at the time. When flexion of the knee is resisted by quadriceps, the hamstring muscles produce extension at the hip. When extension of the hip is resisted by the hip flexors, the hamstring muscles produce flexion of the knee. In addition, the hamstring muscles, acting separately, produce medial rotation and lateral rotation at the knee joint. As we've seen, these movements can only happen when the knee is flexed. The two semi-muscles produce medial rotation. Biceps femoris produces lateral rotation. The other two minor knee flexors that we've seen already are sartorius and gracilis. Here's sartorius, which arises up here. Here's gracilis, arising here. These two insert close to semitendinosus. Sartorius here, gracilis here. We've already seen the actions of these two muscles at the hip. At the knee, they help to produce flexion. Now we'll complete our picture of the muscles around the knee by looking at three muscles at the back that we haven't met yet: popliteus, gastrocnemius, and plantaris. Here's the popliteus muscle. It arises from this area on the back of the tibia and inserts up here on the lateral epicondyle of the femur. The tendon of popliteus passes through the capsule of the knee joint to reach its insertion. Popliteus is a minor flexor of the knee, and it can also produce medial rotation of the tibia. Lying on top of popliteus is the small plantaris muscle. It's a vestigial structure. It arises from the lateral epicondyle of the femur. The tiny tendon of plantaris runs down on the back of this big muscle, soleus. We'll see where it ends up in the next section. Lying on top of the two small muscles that we've just seen is the much larger gastrocnemius muscle. Gastrocnemius arises by two heads from the back of the medial and lateral condyles of the femur. Gastrocnemius runs downward and joins with the underlying soleus muscle, which we'll see in the next section, to form the calcaneal tendon, or heel cord. Gastrocnemius has a slight flexing action at the knee, but its main action by far is at the ankle joint. We'll see it again in the next section. Now that we've seen all the muscles that arise or insert at the knee joint, let's see how they all fit together. You can use this overview as a brief review section. Here on the front are quadriceps, sartorius, and gracilis. On the back, here are semitendinosus and semimembranosus. Here's biceps femoris, and here's gastrocnemius. Here's plantaris and popliteus. Now we'll move on to look at the principal veins, arteries, and nerves in the region of the knee. We'll begin where we saw them last, just below the hip. We'll follow them to just below the knee. With the main artery and vein, there's a change of name that we need to understand. In the upper and middle thigh, they're known as the femoral vessels, but below the adductor hiatus, they're called the popliteal vessels. The same vessels, just a different name. Here's the thigh with the skin removed and a strip of subcutaneous fat taken out so that we can see the long saphenous vein. Here it's in the middle of its course from the ankle to the top of the thigh. To see the femoral vessels, we'll remove the superficial fat and deep fascia. Here are the femoral artery and vein at the point where we saw them last, disappearing beneath the sartorius muscle. To follow their course, we'll remove sartorius and also gracilis. Here's vastus medialis, here's adductor longus, with adductor magnus behind it. The femoral vessels pass beneath the roof of the adductor canal and through the adductor hiatus. To see where they emerge, we'll remove semimembranosus and semitendinosus and go round to the back. Here are the vessels emerging behind adductor magnus. They're now known as the popliteal artery and vein. A little above the knee, the popliteal vessels are joined by the sciatic nerve. At the back of the knee, the popliteal artery lies deep to the nerve and to the popliteal vein. To see the artery better, we'll go to a different dissection in which the muscles are intact and the nerve and the vein have been removed. Above the knee, which is just here, the popliteal artery gives off these two superior genicular arteries, lateral and medial. At the knee, it gives off these branches to the two heads of gastrocnemius. And below the knee, it gives off these two inferior genicular arteries, medial and lateral. The popliteal artery then disappears deep to the two heads of gastrocnemius. We'll see where the vessels go from there in the next section. Now let's look at the nerves. In the last section, we looked at three major nerves: the obturator, the femoral, and the sciatic. We'll follow the sciatic nerve in a minute. The obturator nerve and the femoral nerve we don't need to follow any further, except to remind ourselves of the muscles that they supply. As we've seen before, the obturator nerve supplies obturator externus, adductor brevis and longus, and the anterior part of adductor magnus. The femoral nerve supplies iliacus, pectineus, all four heads of quadriceps, and sartorius. The obturator and femoral nerves also have sensory branches, some of which go below the knee. We'll leave these out. We'll go on now to look at the sciatic nerve. We saw the sciatic nerve a minute ago with the hamstring muscles absent. To see the whole picture, we'll add the hamstring muscles. Here are semimembranosus and semitendinosus. Here's biceps femoris. Here are the two heads of gastrocnemius. The space that's bounded by these muscles is called the popliteal fossa. As we saw in the previous section, the sciatic nerve passes deep to biceps femoris. Here it is emerging. Here are the popliteal vessels coming in beneath the semi-muscles and passing deep to the nerve. Above the knee, the sciatic nerve divides into two major nerves, the tibial nerve and the common peroneal nerve. The tibial nerve runs downward in the midline and passes between the two heads of gastrocnemius, along with the popliteal vessels. The common peroneal nerve diverges laterally, running just behind the tendon of biceps femoris. It passes around the neck of the fibula, here's the fibula, and passes into this muscle, peroneus longus. We'll follow the further course of both these nerves in the next section. Of the muscles that we've seen in this section, the tibial nerve supplies popliteus, gastrocnemius, and plantaris. We'll conclude this section by briefly reviewing what we've seen of the vessels and nerves of this region. Here's the femoral vein and artery, the superior genicular arteries, lateral and medial, and the inferior genicular arteries, medial and lateral. Here's the popliteal artery and vein. Here's the sciatic nerve, the tibial nerve, and the common peroneal nerve. That brings us to the end of this section on the knee. In the next section, we'll look at the leg, the ankle, and the joints of inversion and eversion of the foot. In this section, we'll go from the knee to a little below the ankle. We'll start by looking at the bones and the joints of the ankle region. Then we'll look at the muscles which produce movements at those joints. Lastly, we'll look at the blood vessels and nerves of the region. Before we start, we need to understand the meaning of some anatomic terms regarding the foot and its movements. The upper and lower surfaces of the foot are called the dorsal surface and plantar surface. This part of the foot is called the tarsus. These bones are the tarsal bones. The long bones in front of them are the metatarsals. We'll be looking at two sets of movements which happen in two different places. The upward and downward movements that occur at the ankle joint itself are called dorsiflexion and plantar flexion. The side-to-side rocking movements that occur at the joints just below the ankle are called eversion, for turning outwards, and inversion, for turning inward. Lastly, speaking of definitions, you'll recall that the leg in anatomy means just the part of the lower extremity that's between the knee and the ankle. Now let's look at the bones. We'll start by taking a further look at the two long bones of the leg, the tibia and the fibula. The tibia is much the larger of the two bones. The shafts of the two bones are covered by muscles, except for the anteromedial aspect of the tibia, which lies directly beneath the skin, all the way from the knee to the ankle. The proximal end of the fibula doesn't form part of the knee joint, but its distal end forms an important part of the ankle joint, as we'll see. The tibia and fibula are held together throughout their length by the strong interosseous membrane. Above and below, they're attached at the two tibiofibular joints. The proximal tibiofibular joint is a synovial joint. The distal one is a fibrous joint. There's very little movement at either of these joints. Distally, the two bones are strongly held together by the anterior tibiofibular ligament and the posterior tibiofibular ligament. The projecting ends of the tibia and fibula, which stick out on either side of the ankle, are called the medial malleolus and the lateral malleolus. The articular surface for the ankle joint is a broad notch formed by the curved undersurface of the tibia and the inner surfaces of the medial malleolus and the lateral malleolus. Now let's look at the bone that articulates with the tibia and fibula to form the ankle joint, the talus. This is the talus. The bone below and behind it is the calcaneus or heel bone. The bone in front of the talus is the navicular bone. We'll meet the other tarsal bones shortly. Now we'll go round to the lateral view to see the talus by itself. This is the head of the talus. This is the neck. The talus has three articular surfaces, one on the head and one on the underside for the two joints of inversion and eversion, and one on top for the ankle joint. Here's the ankle joint. Let's see how it looks in the living body. Here, the loose parts of the joint capsule have been removed, leaving these thickened parts, which are the ligaments of the joint. Here's the front of the joint in plantar flexion. Here's the back of the joint in dorsiflexion. On the lateral side, the joint is held together by the posterior talofibular and anterior talofibular ligaments. On the medial side, it's held together by this massive ligament, the deltoid ligament, which attaches not only to a broad area on the talus, but also to the adjoining bones below and in front, as we'll see shortly. The ligaments of the ankle joint ensure that the talus can't rock from side to side, like this, or move backward or forward like this, relative to the tibia and fibula. Here's the ankle joint with its joint capsule intact and with the rest of the bones in place. The capsule of the ankle joint is loose on the front and it's also loose on the back. This looseness allows for a full range of dorsiflexion and plantar flexion. Now we'll move on to look at the two joints of inversion and eversion. There's one directly beneath the main part of the talus called the subtalar joint, and there's one below and in front of the head of the talus that has an unwieldy name, the talo-calcaneo-navicular joint. We'll call it the TCN joint for short. To understand these joints, we need to get acquainted with the remaining tarsal bones. We already know the talus, the calcaneus, and the navicular. In front of the navicular are the three cuneiform bones, first, second, and third. Lastly, the bone in front of the calcaneus is the cuboid bone. Now let's look at the calcaneus by itself. The posterior part of the calcaneus forms the heel. The massive calcaneal tendon also called the Achilles tendon, is attached here. Here on the medial side there's a projecting shelf which the medial part of the talus sits on, called the sustentaculum tali. On the front of the calcaneus there's an articular surface for the cuboid bone. On the upper aspect of the calcaneus there are two articular surfaces for the talus, a small one in front, a larger one behind. The larger of these two surfaces, together with the corresponding surface on the underside of the talus, forms the subtalar joint. The head of the talus fits into a socket, which we'll see by taking the talus away. The socket is formed by this surface of the calcaneus, this surface of the navicular bone, and by a strong ligament here, which we'll see in a minute. These surfaces, together with the head of the talus, form the talo-calcaneo-navicular joint. Here's what these joint surfaces look like in the living body. The surface for the subtalar joint, and the two surfaces for the TCN joint. This structure in between, which forms part of the TCN joint, is the upper surface of the strong calcaneo-navicular ligament, also misleadingly called the spring ligament, which helps to hold up the head of the talus. It goes from here on the calcaneus to here on the navicular. The movement that happens at the subtalar and TCN joints is a rocking motion that takes place around an obliquely placed axis. This rod shows the position of the axis. It's oblique to the long axis of the foot, both in this plane and in this plane. Here's eversion, here's inversion, again eversion and inversion. Several strong ligaments hold the malleoli, the talus, the calcaneus, and the navicular bone together. On the medial side, which we'll see first, there's one extensive ligament to look at, the deltoid ligament. We've seen part of it already. Now here's the whole of the deltoid ligament. This is the part we saw before, going from the medial malleolus to the talus. In addition, parts of the deltoid ligament fan out below onto the sustentaculum tali of the calcaneus, and in front onto the navicular bone, so that the deltoid ligament holds all four of these bones together. On the lateral side there are two important ligaments. The calcaneo-fibular ligament, which goes from the lateral malleolus to the side of the calcaneus, and this strong ligament, the interosseous talocalcaneal ligament, which goes from here on the calcaneus to here on the talus. To see that ligament better, we'll remove the talus. The interosseous talocalcaneal ligament lies between the subtalar joint and the TCN joint. Now that we've seen the ankle joint and the joints of inversion and eversion, we'll look very briefly at the remaining joints of the tarsus. Between the navicular and its neighbors, the cuneiform bones and the cuboid bone, there's hardly any movement, but there is a small amount of rotation between the cuboid and the calcaneus, which lets the front part of the foot invert and evert a little, independently of the calcaneus. We'll see more of the bones and ligaments of the foot in the next section. For now, we've seen enough to understand how the joints of the ankle region move. Before we go on to look at the muscles that produce those movements, we need to take a look at some important pulley-like structures that are attached to the bones of the ankle region. These are called retinacula, the singular of which is retinaculum. Each retinaculum guides and keeps in place a set of tendons that pass from the leg to the foot. There's a retinaculum on the front of the ankle and one on each side of the ankle, behind and below each malleolus. Here on the front are the upper part and the lower part of the extensor retinaculum. These aren't isolated structures, they're localized thickenings of this layer of investing deep fascia, which we'll meet later. 4 tendons, a nerve and an artery pass under the extensor retinaculum. On the lateral aspect, behind the malleolus, here's the peroneal retinaculum. It accommodates the tendons of 2 peroneal muscles as they pass around the lateral malleolus. On the medial side, the flexor retinaculum fans out from the back of the medial malleolus. The space beneath the flexor retinaculum is divided into 4 separate tunnels. 3 tendons and the posterior tibial vessels and nerve pass through these tunnels as they pass around the ankle and into the foot. Now let's review what we've seen of the bones, joints and pulleys of the ankle region. Then we'll move on to look at the muscles of the leg. Here's the tibia, the fibula, the medial malleolus, the lateral malleolus, the talus, and the ankle joint. Here's the interosseous membrane, the proximal tibiofibular joint, the distal tibiofibular joint, the posterior tibiofibular and talofibular ligaments, the anterior tibiofibular and talofibular ligaments, and the deltoid ligament. Here's the calcaneus, the cuboid, the 3 cuneiform bones, and the navicular. Here are the surfaces for the subtalar joint and for the TCN joint. Here's the calcaneo-navicular ligament, the calcaneo-fibular ligament, and the interosseous talocalcaneal ligament. Here's the extensor retinaculum, the peroneal retinaculum, and the flexor retinaculum. Now we'll move on to look at the muscles that produce movement at the joints of the ankle region. In doing this, we'll meet most, but not all, of the muscles that are in the leg. There are 4 muscles that are in the leg, which we'll leave out of the picture till the next section. These are the long flexors and the long extensors of the toes. Along with the muscles, we'll meet the various layers of deep fascia, which divide the muscles of the leg into rather distinct compartments. We'll start with the muscles that produce dorsiflexion and plantarflexion at the ankle joint. Next, we'll look at the fascial layers and compartments. Lastly, we'll look at the muscles of inversion and eversion. First then, the dorsiflexors and plantarflexors. Dorsiflexion involves just lifting the foot. Plantarflexion involves lifting the whole body. So it's not surprising that the muscles for plantarflexion are much larger than the ones for dorsiflexion. There's 1 muscle on the front of the leg for dorsiflexion, tibialis anterior. There are 3 on the back of the leg for plantarflexion, gastrocnemius, soleus, and plantaris. Here's tibialis anterior. Tibialis anterior arises from the lateral surface of the upper tibia and from the interosseous membrane. The tendon of tibialis anterior passes under the extensor retinaculum and winds around the medial side of the tarsus to insert right down here on the first cuneiform bone and on the base of the first metatarsal. The main action of tibialis anterior is to produce dorsiflexion at the ankle. Dorsiflexion is not the only action of tibialis anterior. It also has a role in producing inversion, as we'll see shortly. What's more, tibialis anterior is not the only muscle that produces dorsiflexion. It's assisted in that by the long extensor muscles for the toes, which we'll see in the next section. We'll move on now to look at the muscles that produce plantarflexion. 2 large muscles, gastrocnemius and soleus, and 1 small muscle, plantaris, join together to form the massive calcaneal tendon. Here's gastrocnemius. Here, deep to it, is soleus. Gastrocnemius has two heads, a medial and a lateral. These arise, as we've seen, from the medial and lateral condyles of the femur. The two heads of gastrocnemius unite, forming a flat tendon. The gastrocnemius tendon, in turn, unites with the tendon of soleus to form the calcaneal tendon. To look at soleus, we'll remove gastrocnemius. Here's the whole of soleus. Here's its medial border. Here's its lateral border. Here's the cut edge of the gastrocnemius tendon. Soleus arises from the medial edge of the tibia, from this oblique line on the back of the tibia, and from this area on the back of the fibula. Between the fibula and the tibial origins of soleus, there's an arch of fibrous tissue. The popliteal vessels and the tibial nerve pass beneath this arch. Here are their divided ends. For completeness, we'll add plantaris to the picture. Here it is. Plantaris arises here, on the lateral epicondyle of the femur. The long tendon of plantaris runs almost to the ankle before uniting with the calcaneal tendon. The calcaneal tendon is also known as the Achilles tendon, or simply the heel cord. It inserts into a broad area here, on the back of the calcaneus. In front of the calcaneal tendon, there's a pad of fat which fills the gap between the tendon and the back of the ankle joint. The action of soleus, gastrocnemius, and plantaris is to produce plantar flexion at the ankle joint. Their action lifts us up off the ground when we stand on tiptoe. When balanced against gravity, the same action controls our rate of descent. In addition, these muscles provide an important part of the propulsive force in normal walking, in going uphill, in running, and in jumping. Before we move on to see the muscles that produce inversion and eversion, we need to digress for 2 minutes to look at the layer of deep fascia that surrounds all the muscles of the leg, and the 3 fibrous partitions, or septa, that divide the leg muscles into somewhat distinct compartments. This outer layer is the investing deep fascia. It surrounds all the muscles of the leg. The investing deep fascia is attached to the tibia here and here. It's attached to the fibula not directly but indirectly by 2 fibrous septa here and here that we'll see in a minute. The investing deep fascia wraps around the back of the calcaneal tendon like a sling. Distally, the investing deep fascia is continuous with the superficial part of the flexor retinaculum, with the perineal retinaculum, and with the 2 parts of the extensor retinaculum. Now we'll look at the fibrous septa, the singular of which is septum. There are 3 of them. Together with the interosseous membrane, they divide the muscles of the leg into 4 compartments, 2 on the front of the leg and 2 on the back. We'll look at the back first. We'll remove gastrocnemius and soleus down to here. Here's soleus divided. Here's the investing deep fascia divided at a lower level. In front of soleus, this transverse intermuscular septum crosses the back of the leg. It runs from here on the tibia to here on the fibula. Three muscles that we haven't seen yet lie between the transverse septum and the bones. To see the transverse septum better, we'll remove the rest of the soleus. The transverse septum is thin up here, but toward the ankle it becomes thicker. At the ankle, the transverse septum is continuous with the flexor retinaculum. The other two septa have cumbersome names. They're the anterior and the posterior crural intermuscular septa. To see them, we'll remove the investing deep fascia down to here, exposing several muscles that we haven't met yet. We'll be meeting them soon. This is the posterior crural septum, lying just in front of the soleus muscle. This is the anterior crural septum. These two septa are attached to the fibula here and here. The anterior crural septum divides the muscles in front of and lateral to the two bones into an anterior compartment, which contains 4 muscles, including tibialis anterior, and a more laterally placed perineal compartment, which contains 2 of the 3 perineal muscles. Now that we've seen these fascial structures, let's get back to the muscles, the ones that produce inversion and eversion. There are 2 muscles that produce inversion, tibialis anterior, which we've seen already, and tibialis posterior. Here's tibialis posterior. Tibialis posterior arises from the back of the tibia, the back of the fibula, and from the interosseous membrane in between. Its tendon passes immediately behind the medial malleolus through a fibrous tunnel that's covered by the flexor retinaculum. Beyond the malleolus, the tendon of tibialis posterior fans out. It has a wide insertion here on the navicular and first cuneiform bones, and also under here on the bases of the 2nd, 3rd, and 4th metatarsals. Here's the action of tibialis posterior. It inverts the foot. The other muscle that can act as a foot inverter is tibialis anterior, which inserts so close to tibialis posterior that it has almost the same line of action. We looked at tibialis anterior in its role as an ankle dorsiflexor earlier in this section. Now we'll move on to look at the 3 muscles that evert the ankle: peroneus longus, brevis, and tertius. Here's peroneus brevis. Peroneus brevis arises from here on the distal fibula. Lying on top of peroneus brevis is peroneus longus. Peroneus longus arises from here on the proximal fibula. Its origin extends up onto the head of the fibula with a gap here. The deep peroneal nerve passes under the upper end of peroneus longus here, as we'll see. The other muscle in the picture here is tibialis anterior. At the ankle, the tendons of peroneus longus and brevis pass behind the lateral malleolus and beneath the perineal retinaculum, longus behind, brevis in front. Peroneus brevis runs forward to insert here on the base of the 5th metatarsal. To see the remarkable course of the peroneus longus tendon, we have to remove the entire sole of the foot. Peroneus longus runs around the cuboid bone and along a deeply placed fibrous tunnel to insert right over here on the base of the 1st metatarsal. Lastly, in front of peroneus brevis and longus, here's peroneus tertius. Peroneus tertius arises from here on the fibula. The tendon of peroneus tertius passes under the extensor retinaculum and in front of the lateral malleolus to insert here on the base of the fifth metatarsal next to peroneus brevis. The action of all three of the peroneal muscles is to evert the foot. In addition, peroneus tertius, acting along with its anterior neighbors, can help to dorsiflex the ankle. The muscles of inversion and eversion are important because they enable us to stay balanced and upright on a surface that tilts to one side or to the other. Now that we've looked at the muscles that produce movement of the foot, we're nearly ready to move on to the vessels and nerves of this region. Before we do that, let's review what we've seen of the muscles and the associated fascial structures. Here's the investing deep fascia. Here's the posterior crural intermuscular septum, the anterior crural intermuscular septum, and the transverse intermuscular septum. Here's tibialis anterior, gastrocnemius, soleus, and plantaris, and the calcaneal tendon. Here's tibialis posterior, peroneus longus, peroneus brevis, and peroneus tertius. Now we'll move on to look at the vessels and nerves of the region. We'll go from the knee, where we saw them last, to just below the ankle. We'll start with the veins. Here's the leg with the skin removed. To expose the two major superficial veins, two strips of subcutaneous fat have also been removed. Here's the short saphenous vein on the back, and the long saphenous vein on the front. The long saphenous vein passes over the medial malleolus, which is here, and runs up the medial side of the leg. We've seen its more proximal course in the previous sections of this tape. The short saphenous vein runs up between the calcaneal tendon and the lateral malleolus. It goes up the back of the leg and passes through the deep fascia near the knee to join the popliteal vein. To see some of the superficial veins in more detail, we'll remove the subcutaneous fat from the back of the leg. The short saphenous vein, like the long saphenous vein, is joined by a number of superficial branches. The saphenous veins are also joined by several perforating veins like this one, which bring blood from the muscle compartments that lie deep to the investing deep fascia. In the last section, we saw the principal deep vein of the leg, the popliteal vein. Here it is again. With the tibial nerve behind it and the popliteal artery in front of it, it disappears between the two heads of gastrocnemius. In this section, we won't follow the deep veins any further, since their course is just the same as that of the corresponding arteries. We'll look at the arteries next. The three main arteries which supply the leg and ankle region are all branches of the popliteal artery. They're the anterior tibial, the posterior tibial, and the peroneal. In the dissection that we'll see, all the veins have been removed to simplify the picture. Here's the popliteal artery, passing between the two heads of gastrocnemius. Its branches to gastrocnemius have been removed. To follow the popliteal artery, we'll remove gastrocnemius. The popliteal artery runs down the back of the popliteus muscle, then passes through the fibrous arch in the origin of soleus. We'll remove soleus. At the lower border of the popliteus muscle, the popliteal artery gives off this major branch, the anterior tibial artery, which runs forwards. We'll follow it in a minute. The popliteal artery then ends by dividing into the peroneal artery and the posterior tibial artery. we'll follow the posterior tibial artery first. It runs down the back of the leg, just behind the deep posterior muscles. It's covered by the increasingly thick transverse intermuscular septum, which we'll remove. As it passes toward the medial side of the ankle, the posterior tibial artery lies just behind tibialis posterior. At the ankle, the artery passes through a tunnel beneath the flexor retinaculum, part of which has been removed here. Within its tunnel, the posterior tibial artery divides into the medial plantar and lateral plantar arteries, which we'll follow in the next section. Next, we'll look at the perineal artery. The perineal artery passes laterally and runs beneath a muscle that we'll be looking at in the next section, flexor hallucis longus. We'll remove it. The perineal artery runs down between the deep posterior muscles, close to the fibula, which is here. It gives off numerous branches to the surrounding muscles and ends behind the lateral malleolus. Lastly, we'll look at the anterior tibial artery. Here's where we saw the anterior tibial artery last, arising from the popliteal artery. It immediately passes forward through a gap in the interosseous membrane. We'll go round to the front to follow it. Here it is emerging. The anterior tibial artery runs down the leg on the interosseous membrane, just lateral to tibialis anterior. The long toe extensors, which have been removed in this dissection, lie lateral to the artery. At the ankle, the anterior tibial artery passes beneath the extensor retinaculum. Here's the artery emerging on the dorsum of the foot. Beyond this point, it's called the dorsalis pedis artery. We'll follow it further in the next section. Now we'll look at the nerves of this region, the tibial nerve and the common perineal nerve. We saw them last at the knee, the tibial nerve disappearing, along with the popliteal vessels, between the heads of gastrocnemius. The common perineal nerve disappearing underneath peroneus longus. We'll look at the tibial nerve first. To follow it, we'll remove two muscles which it supplies, gastrocnemius and soleus. The tibial nerve follows the same course as the posterior tibial artery. The nerve passes beneath the flexor retinaculum, just behind the artery. Beneath the flexor retinaculum, the tibial nerve divides into the medial plantar nerve and the lateral plantar nerve. We'll see where these go in the next section. In the leg, the tibial nerve supplies gastrocnemius, plantaris, soleus, and all three of the deep flexor muscles, including tibialis posterior. Now we'll follow the common perineal nerve. As it passes under the peroneus longus muscle, the common perineal nerve divides into the superficial perineal nerve and the deep perineal nerve. The superficial perineal nerve runs down beneath peroneus longus. It emerges here and continues down to the foot as a sensory nerve, as we'll see in the next section. The superficial perineal nerve supplies peroneus longus and peroneus brevis. The deep perineal nerve runs under peroneus longus. Here it is again. And then under this adjoining muscle, which is extensor digitorum longus. Here's the deep perineal nerve emerging just medial to the anterior tibial vessels and medial to tibialis anterior. The deep perineal nerve follows the same course as the anterior tibial vessels as it runs down the leg and under the extensor retinaculum. Of the muscles that we've already seen in the leg, the deep perineal nerve supplies tibialis anterior and peroneus tertius. Now let's review what we've seen of the vessels and nerves of the leg and ankle region. Here's the long saphenous vein, the short saphenous vein, and the popliteal vein. Here's the popliteal artery, the perineal artery, and the posterior tibial artery, the medial plantar and lateral plantar arteries, and the anterior tibial artery. Now the nerves, the tibial nerve, the medial plantar nerve, and the lateral plantar nerve, the common perineal, superficial perineal, and deep perineal nerves.